Imagine waking up one morning covered in strange red rashes. Or picture yourself stepping off a curb wrong and feeling that sickening crack in your leg. In both situations, you know you need a doctor, but which one? That's the thing most people never stop to think about. The medical world isn't a one-size-fits-all system. It's a vast, specialized network of professionals, each trained to handle a very specific part of the human body. And if you walk into the wrong office, you're not just wasting time, you could be delaying care you actually need. So today, we're going to fix that. We're going to walk through the most important types of doctors, what they actually do, and how to pronounce their names correctly, because some of these titles are anything but straightforward. Let's start with the most familiar face in medicine, the general practitioner. You've probably heard them called a family doctor, and that's exactly what they are. Think of the general practitioner as your first stop for anything that feels off but isn't an emergency. A sore throat that won't quit, a headache that's been hanging around for days, a stomachache that just won't settle. These are the kinds of problems a general practitioner is trained to handle. They're the doctors who know you, your history, and your family's health patterns. They're the ones who decide whether your symptoms are something they can treat themselves or whether you need to be referred to a specialist. In many ways, the general practitioner is the backbone of everyday health care. Without them, the entire medical system would be overwhelmed with patients flooding specialized clinics for problems that simply need a prescription or a little professional reassurance. Now, once you step beyond the general practitioner, things get more specific and more interesting. Take the dermatologist, for example. The name comes from the Greek word for skin, and that tells you almost everything you need to know. A dermatologist is the doctor who specializes in skin, nails, and hair. So the next time you spot those alarming red rashes spreading across your arm, or you notice your nails developing unusual discoloration, or your hair is thinning in ways that feel sudden and unexplained, a dermatologist is the person you want to see. Skin is the body's largest organ, and it's constantly exposed to the environment, which means it's also constantly vulnerable. Dermatologists don't just treat cosmetic concerns, though they do that too. They diagnose and treat serious conditions like psoriasis, eczema, and even skin cancer. The skin speaks, and a dermatologist knows how to listen to it. Moving on from skin to something a little more personal, your mouth. Now, hands up if you genuinely enjoy going to the dentist. Most people don't, and honestly, that's understandable. The sounds, the tools, the bright light aimed directly at your face, it's not exactly a relaxing experience. But here's the thing, dentists are among the most important doctors you'll ever visit, and the reason is simple. Your oral health is directly connected to your overall health. Poor dental hygiene has been linked to heart disease, diabetes, and a range of other serious conditions. A dentist is the doctor who takes care of your teeth and gums, treating everything from cavities and infections to more complex issues like misalignment and gum disease. Medical experts consistently recommend that every person visit a dentist at least twice a year, not just when something hurts, but as a routine part of staying healthy. The problem is that most people only make that appointment when the pain becomes unbearable. By then, what could have been a simple fix has often turned into something far more complicated and expensive. So if you've been putting off that dental visit, consider this your reminder. The dentist isn't your enemy, they're one of your most important allies in long-term health. Now let's talk about an organ that never takes a break, the heart. The doctor who specializes in heart health is called a cardiologist. If you've ever been diagnosed with or are at risk of cardiovascular disease, which includes conditions like high blood pressure, blocked arteries, heart attacks, or irregular heartbeats, a cardiologist is the specialist you'll be referred to. The word cardiovascular refers to the heart and blood vessels together, and a cardiologist is trained to assess, diagnose, and treat the full range of problems that affect this system. They use tools like EKGs, stress tests, and echocardiograms to understand exactly what's happening inside your chest. One thing worth clarifying, though, and this is important, a cardiologist deals exclusively with the physical organ. They are extraordinarily skilled at what they do, but fixing a broken heart in the emotional sense, that's beyond their job description. When a relationship ends and you feel that hollow ache in your chest, no amount of medical expertise can treat that. The cardiologist's domain is the beating muscle, the rhythm, the blood flow. Everything else you'll need to work through in other ways. Let's shift now to a branch of medicine that plays a crucial role in one of the most profound experiences a human being can go through: pregnancy and childbirth. The doctor at the center of female reproductive health is called a gynecologist, though you'll often hear people shorten it to gynec in everyday conversation. A gynecologist specializes in the female reproductive system, handling everything from routine checkups and menstrual health to diagnosing and managing more complex conditions affecting the ovaries, uterus, and related organs. For pregnant women, the gynecologist is typically the first and most consistent medical presence throughout the journey. However, there's an important distinction that many people don't realize. When it comes to surgical procedures, delivering a baby through cesarean section, removing ovarian tumors, or performing other operations within the reproductive system, the doctor who actually performs those surgeries has a different title. They're called an obstetrician. So while the gynecologist manages and monitors, the obstetrician is the one who operates. In practice, many doctors are trained in both areas and hold the combined title of OB/GYN. But understanding the difference between the two roles helps you know exactly what kind of care you're receiving and why. From reproduction, let's move to something many of us take for granted until it starts to fail: our eyesight. The doctor who specializes in vision and eye health is called an optometrist. If you've been squinting at road signs, struggling to read text on your phone, or waking up with persistent eye irritation, an optometrist is who you need. They examine the eyes, test vision, prescribe corrective lenses, and diagnose a range of conditions from nearsightedness and farsightedness to infections and early signs of more serious eye disease. The eyes are remarkably complex organs, and their health can actually reflect the state of the rest of your body. An optometrist doesn't just help you see more clearly, they're often the first to catch signs of conditions like diabetes or high blood pressure through a routine eye exam. Now let's talk about the doctor you hope you never urgently need, but are incredibly grateful for when you do: the orthopedic surgeon. If you've ever been in an accident, broken a bone, or dealt with serious joint pain, this is the specialist who steps in. An orthopedic surgeon works with the skeletal system, the bones, joints, ligaments, tendons, and muscles that give your body its structure and allow it to move. A broken leg, a fractured wrist, a shattered collarbone, these are all situations that land you in the orthopedic surgeon's care. But orthopedic care isn't limited to dramatic accidents. As people age, the skeletal system naturally begins to wear down. Joint pain in the knees and hands becomes increasingly common, and conditions like arthritis, where the cartilage between joints breaks down, can significantly reduce a person's quality of life. Orthopedic surgeons treat all of this. They perform joint replacements, repair torn ligaments, and use a range of surgical and non-surgical approaches to restore mobility and reduce pain. When your body's framework is compromised, the orthopedic surgeon is the engineer who rebuilds it. Next, let's talk about a doctor whose patients range from newborns to teenagers: the pediatrician. A pediatrician is a doctor who specializes in the health and development of infants, children, and adolescents. If you've ever walked into a pediatric clinic, you've probably noticed something immediately different about it. The walls are colorful, there are toys in the waiting room, and the entire environment is designed to feel welcoming and safe for young patients who might otherwise be frightened. That's intentional. Pediatricians are not only trained in the medical conditions that affect young people, from ear infections and childhood asthma to growth disorders and developmental delays, they're also skilled at communicating with patients who may not yet have the words to describe what they're feeling. It's a specialty that demands both clinical expertise and a particular kind of patience and warmth. Now here's where things get a little confusing, because we have two doctors with very similar sounding names, and people mix them up all the time. The first is a urologist. A urologist is a doctor who specializes in the urinary tract, which includes the kidneys, bladder, and the tubes that carry urine through the body, as well as the male reproductive system. So if a man is experiencing issues with his reproductive organs, the doctor he needs to see is not a gynecologist. That's a common misconception. The gynecologist focuses on the female reproductive system. For male reproductive health, the correct specialist is the urologist. Similarly, if anyone, male or female, is dealing with recurring urinary tract infections, kidney stones, bladder problems, or related conditions, the urologist is the right point of contact. It's worth taking a moment to understand why people confuse gynecologists and urologists so often. The overlap in the general idea of reproductive health leads many people to assume they're interchangeable. They're not. The training, the focus, and the conditions they treat are distinct. Knowing the difference means you get to the right doctor faster, which means faster diagnosis, faster treatment, and less time spent in discomfort or uncertainty. Medicine is most effective when you know exactly where to direct your questions. Now, the second doctor with a name that sounds strikingly similar, the neurologist. Where the urologist deals with the urinary system and male reproduction, the neurologist deals with the human brain and nervous system. Any condition that affects how the brain functions, whether that's migraines, epilepsy, multiple sclerosis, Parkinson's disease, or nerve damage, falls within the neurologist's area of expertise. They study the brain's electrical activity, examine nerve responses, and work to understand what's going wrong in the body's most complex command center. And when the brain's condition moves beyond medication and monitoring into the territory of surgery, when a tumor needs to be removed or a blood vessel repaired, or pressure on the brain relieved, the person who performs that operation is called a neurosurgeon. The neurologist and the neurosurgeon often work closely together. The neurologist identifies and manages the condition, and the neurosurgeon steps in when the situation requires an operation. It's a partnership that reflects how modern medicine works at its best, specialists collaborating across their areas of expertise to give patients the most complete care possible. What's remarkable about the human body is that it's so complex, so layered, and so intricately connected that no single doctor could ever master all of it. That's precisely why medical specialization exists. Each type of doctor represents years, sometimes decades, of focused training on one particular system or set of conditions. The dermatologist knows the skin in a way the cardiologist never will. The pediatrician understands childhood development in ways the orthopedic surgeon doesn't need to. And the neurologist navigates the brain with a level of precision that took a lifetime to develop. What this means for you as a patient is that knowing which doctor to see isn't just a matter of efficiency. It's a matter of getting the right help at the right time. Walking into a general practitioner's office when you need an orthopedic surgeon, or seeing a gynecologist when you should be seeing a urologist, doesn't just slow things down, it can lead to misdiagnoses and delayed treatment. The more you understand about the medical world, the more confidently you can navigate it. So let's do a quick recap. The general practitioner handles common, everyday health concerns. The dermatologist takes care of skin, nails, and hair. The dentist manages your teeth and gum health. The cardiologist focuses on your heart and blood vessels. The gynecologist and obstetrician together cover female reproductive health and surgery. The optometrist looks after your eyes and vision. The orthopedic surgeon deals with bones, joints, and the skeletal system. The pediatrician specializes in the health of children and teenagers. The urologist handles the urinary system and male reproductive health. And the neurologist, along with the neurosurgeon, takes care of the brain and nervous system. These are just the most common types, the ones you're most likely to encounter in everyday life. The world of medicine goes far deeper, with hundreds of subspecialties covering every corner of human health. But mastering these foundational categories gives you a powerful starting point. Now that you know who does what, the next step is putting that knowledge to the test. Think about a health issue, anyone that comes to mind, and ask yourself, which doctor would you see? The answer might surprise you.